If a patient is charged with the possession of marijuana, is it possible to use medical necessity as a defense? Yes. It was possible for a judge to allow an individual to raise a medical necessity defense based on the state having a symbolic medical marijuana law, and in Iowa that happened. An Iowa judge ruled that a medical marijuana user's probation could not be revoked for using marijuana because the Iowa legislature had defined marijuana as a Schedule II drug with, quote, currently accepted medical use, unquote. Of note, Iowa moved marijuana into Schedule II in 1979 when it had enacted a therapeutic research program. The research program expired in 1981, but marijuana's schedule remains in place. A 2005 National Gallup poll found that 78% of Americans support making marijuana legally available for doctors to prescribe in order to relieve pain and suffering. For over a decade, polls have consistently shown that 60 to 80% support for legal access to medical marijuana. Prominent health and medical organizations, including the American Academy of HIV Medicine, the American Nurses Association backed it in 2003, American Public Health Association, Leukemia Lymphoma Society, Lymphoma Foundation, and as I stated earlier, American College of Physicians. At the present time, marijuana is a Schedule I drug, which means, A, the drug has a high potential for abuse. This is not true. When compared to other drugs such as Valium, Xanax, sleeping pills, and other opiates, which are much more addictive and are not Schedule I drugs. Beer and tobacco are much more addictive. The drug has no currently accepted medical use and treatment in the United States. This is not true. Just read the medical literature. There is a lack of safety for the use of the drug under medical supervision. This is not true. Francis I. Young, Chief Administrative Law Judge, said on September 6, 1988, quote, marijuana is, in its natural form, is one of the safest therapeutically active substances known, unquote. It is time to legalize the passage of a law in Iowa allowing doctor-advised medical use of marijuana. Let physicians certify deserving patients with debilitating conditions which have been previously mentioned to receive the medical benefits of marijuana, which likely outweighs the risks. Drug abuse is bad. But drug wars are worse. One thing that I have also is, where is the harm in drugs? And one of the things you have to do is, when you talk about a drug, you have to bear in mind, what is the harm? Reducing the harm of marijuana is a public health philosophy that seeks to lessen the dangers that marijuana abuse and policy causes to society. A reduction in the harm policy is a comprehensive approach to drug abuse and drug policy. Harm reduction's complexity lends to its misperception as a drug legalization tool. Reduction in the harm of marijuana rests on several basic assumptions. A basic tenet of harm reduction is that there never has been, is not now, and never will be a drug-free society. Whereas the success of current drug policies is primarily measured by the changes in use rates, the success of a harm reduction strategy is measured by the changes in rates of death, disease, crime, and suffering. Because incarceration does little to reduce the harm that any ever-present drug causes to our society, a harm reduction approach favors treatment of a drug addiction by healthcare professionals over incarceration in the penal system. Because some drugs, such as marijuana, have proven medicinal uses, a harm reduction strategy not only seeks to reduce the harm that drugs cause, but also to maximize their potential benefits. A harm reduction strategy recognizes that some drugs, such as marijuana, are less harmful than tobacco, cocaine, alcohol, methamphetamines, and many others. Harm reduction mandates that the emphasis on intervention should be based on relative harmfulness of the drug to society. A harm reduction approach that advocates lessening the harms of drugs through education, prevention, and treatment. Harm reduction seeks to reduce the harms of drug policies dependent on an overemphasis on interdiction, such as arrest, incarceration, establishment of a felony record, lack of treatment, lack of adequate information about drugs, the expansion of military source control intervention efforts in other countries, and the intrusion on personal freedom. Harm reduction also seeks to reduce the harms caused by an overemphasis on prohibition, such as increased purity, black market adulterants, black market sale to minors, and black market crime. A harm reduction strategy seeks to protect youth from the dangers of drugs by offering factual, science-based education and eliminating youth black market exposure to drugs. Finally, harm reduction seeks to restore basic human dignity to dealing with the disease of addiction. Thank you.